Hi everyone and welcome back. My name is Mary Marsh. This is my final post which serves as a conclusion to the debate and will summarize my arguments and rebuttal and share some final thoughts pertaining to the decriminalization of all drugs and substances for personal use. I sided on the opposition, the belief that all drugs and substances for personal use should not be decriminalized. This is just a summary of my original arguments. I began by sharing the intended outcomes of decriminalization and then shared how decriminalization has not achieved its intended effects. I first shared how decriminalization is not successful in improving connection to services and supports due to a lack of public health funding. I aim to prove this point by citing Oregon's failed decriminalization. Drawing on Canadian sources such as the Canadian Institute of Health Research, I shared how British Columbia did not adequately fund harm reduction sites, providing statistics such as 70% of sites reported turning clients away due to insufficient capacity or resources. I then argued how decriminalization has not been shown to reduce drug poisoning events or deaths, drawing on statistics from BC Emergency Services and how surveys showed most participants reported no change in their substance use patterns, though some noted a slight increase in use due to feeling safer using drugs in public post-decriminalization. My final argument was how decriminalization does not reduce structural or societal stigma. I supported this by citing a cross-sectional qualitative study of people who use drugs across British Columbia, sharing how more than half of the participants recounted experience of societal, structural, or self-stigmatization. I then referred to the federal government's announcement in May 2024 that they had approved the province of British Columbia's request to exempt public spaces from BC's decriminalization policy, effective immediately, allowing law enforcement agents to seize illegal drugs possessed in public in any amount and make an arrest, highlighting the continued stigma surrounding substance use, especially in public spaces. Catherine had the following three arguments, her first being the financial impacts of criminalization. I argue that the majority of her information came from a single position paper published in 2023. The article states how criminalization costs the healthcare system $1 billion. This cost is linked directly to overdoses, and if you recall, decriminalization has not been shown to reduce drug poisoning events and death. Data from BC Emergency Services shows that overdose and poisoning calls in BC increased by 25% following decriminalization. Her second argument is the impact of criminalization on racialized and or impoverished community members. Catherine is correct in saying that the harms associated with criminalization are disproportionately experienced by those who are most marginalized in our society. With that being said, Canada's substance use services do not effectively address underlying structural factors such as poverty, racism, homelessness, and colonization, which are known to increase the risk of drug-related harm. I further explained how Oregon's failure demonstrated how decriminalization does not reduce racial inequalities within the criminal legal system. Her third argument is that decriminalization is part of a robust public health response. Catherine's argument states how BC's decriminalization project destigmatized people who use drugs and supports with complementary service investments such as additional housing and health supports. I argue that effective drug policy implementation and sustainability relies on knowledge and supports among stakeholders. Unfortunately, Canada's substance use service systems are highly fragmented and often isolated from mainstream health and social care. I further argue that decriminalization aims to improve access to health services and pathways, but the statement assumes that the treatment infrastructure exists and is adequately funded. In Canada, only half of the recommended amount of funding goes to mental health, demonstrated the lack of supports within the province. In summary, the toxic drug crisis in Canada continues to claim lives at a concerning rate. While the premise behind decriminalization is good, research has shown that it does not achieve its intended outcomes. Funds would be better allocated to support a robust public health model, focusing on prevention, treatment, recovery supports, and addressing the broader socioeconomic conditions affecting our communities. Thank you so much for listening to my presentation. You'll find the references at the end.